guess what? I'm not a real estate guy. But remember what I said earlier? Huge believer in the power of teams and community. So I said, if I'm going to pull this idea off, I need a team around me. So I approached one of our state's preeminent real estate developers in the state of Colorado, a group called Coble & Company. They've been at it for 4 generations, 65 years, well-heeled to build something of this magnitude, which you're going to see some real pictures in just a moment. And then I said it has to be built in a certain district just adjacent to Coors Field in downtown where all these innovators are moving into. It's called the River North District. And in 2014, 2015, when I was hatching this idea, a lot of people thought I was nuts because it was an old industrial park closely connected to downtown, and you wouldn't go down there. Well, guess who's laughing now? TripAdvisor just named our district one of the top 10 coolest neighborhoods in the entire nation. You can't even buy a piece of dirt there now. And so I had this idea, if we could bring startups together with deliverance of care, with established companies, big anchor tenants, and let them mix and interact every single day with everybody having the same goal of reimagining healthcare, imagine what could happen under that roof. Well, there was the idea on a drawing, and here's the picture taken mere weeks ago. Ladies and gentlemen, this is the hardest thing I've ever done. That includes earning a full-ride scholarship to Stanford. That includes playing in the NFL. That includes walking out of that school with 2 degrees. This was the hardest thing. Why? This industry doesn't want to change very easily, and the folks in this room that are in it, you know what I'm talking about. But we got to do it. What this represents is an $82 million piece of infrastructure, 180,000 square feet. Just to put this in perspective of how big this campus is, right here alone is a 300-person event hall for whether it's a one-woman startup or our anchor tenant on the top floor who's UC Health, who's taken 20,000 square feet. You have access to that event hall. 4 restaurants. Kaiser Permanente, the 3rd largest health system in the nation, delivering care on the ground floor with the provider, with the entrepreneur, and again, with the patient involved. 5+ different health systems, 6 different academic institutions, 7 different associations, 60+ startups, global number 79, Hitachi on the 2nd floor. And we're just getting going. This was a picture that I took literally the second day we opened. Let me give you some perspective. The plastic is still on the carpet. These 2 guys had never known each other. And they ran into each other on our main staircase, which we intentionally designed for exactly what you're seeing right now. The opportunity for these leaders to bump into each other, learn from one another, and more importantly, create partnerships. And let me read exactly from a press release today. And again, you can find what I'm reading at mikebiselli.com. Delta Dental of Colorado, serving the dental community, and Creo, our state's HIE, both moved into this campus. And here's the press release that they put out this morning at 9 a.m. Mountain Time. Delta Dental of Colorado and Creo are both tenants of the healthcare industry integrator space in Denver's River North District. An informal meeting in the fall of 2018 turned into a full-fledged plan to tackle one of the most persistent problems in oral health care. People getting oral health care in emergency room settings when they should be getting regular preventative care in a dental setting. By using Creo's data services and health information exchange technology to analyze clinical and claims data for a certain segment of Delta Dental's membership, the partners are now attempting to identify opportunities to deliver proactive care to improve the patient experience, improve population health, and most importantly, reduce the cost of health care. And the CEO of Creo said the following, quote, "This groundbreaking project with Delta Dental is a culmination of years of hard work by so many healthcare organizations in Colorado who are dedicated to building a robust health information exchange. And through this collaboration, we're incredibly excited to work together for greater integration between physical and oral healthcare providers to improve patient outcomes and experiences. And we are thrilled that the idea for this exciting project all started at Catalyst, a community of innovators that we are proud to be a part of. That's what happens in here every day. Here's a community happy hour just a couple weeks ago, just like we're doing tonight. We just high-fived each other. We're building community out in the foyer. We're hanging out, learning about new ideas. We're doing this almost every day. Here was a morning salon breakfast in Medical Group Management Association's office. Let me put it in context, the power of this group. MGMA represents 50,000 hospital administrators, and through that, 500,000 providers, and you heard both numbers correctly. They have the UC Health head of innovation on the far left and the head of innovation for Kaiser on the far right. The gentleman in the tan jacket is the senior vice president of Hitachi, and the gentleman in the black jacket is the CEO and founder of Hippo Health. All tenants on campus, learning from one another. Matter of fact, the folks on the end of the table are both competitors in the marketplace. We call that co-opetition. We even do yoga in our event hall. Get together, build community, get to know one another, bring in our family members, and then the next day we get together and have meetups just like you're doing tonight right on campus. This is actually a group of comedians who came in and actually taught us how to pitch. It was ridiculously funny. You can see they're picking on Sarah Silverman. And of course, our women of Catalyst. I am incredibly passionate about getting more women into the C-suite and the boardrooms of our industry because we don't have enough of you. Look out for these ladies on our campus. They're coming after you. And again, here's just another fireside chat with one of our healthcare law firms in the campus that's talk about data security and governance of our personal health information. Ladies and gentlemen, we have an opportunity in front of us that many of us will only see once in a lifetime around this entire country. Every single community around this nation, I'm seeing healthcare innovation ecosystems sprouting up. And everybody has a little bit of a different twist on it, which is a great thing. Some of the conversations we had here over the past 2 days is around behavioral mental health. Yes, let's do this. And then let's learn from one another. Let's learn what they're doing in Seattle and Boston and Traverse City and Detroit and Denver and Austin and Tampa, San Francisco. I can go on and on and on. Because it is going to take every single community around this country that's dedicated to reimagining healthcare to knock this ivory tower down. And as I said during our opening party at Catalyst in July, to the established healthcare industry, you have been officially put on notice, and if you don't get with us, we're coming after you. We have to change, we must change, and we will change by doing it together. And if you are passionate about reimagining healthcare, you have a seat at our table. Thank you.
That was awesome.
Isn't that fun?
That's fun. I like fun.
Absolutely.
Who are you bringing up?
He's part of the Q&A.
I'm just following his lead.
Well, I'll give this back.
I guess we have Q&A now.
Yeah, you bet.
In the back. Can you grab the mic?
So obviously you've had amazing success. As with any great adventure, there's always some really painful lessons learned. So what are the top 2 or 3 things that we can learn from you to avoid as we try to achieve and mirror some of your success?
Don't try to boil the ocean. Find your strengths as a community. You know, one thing that we heard over the past couple of days is their dedication to behavioral mental health here. Maybe that's your swim lane, right? Find one spot that you guys can shine as a community and go after that to prove it out first. Next, check the parochialism at the door. Check your egos at the door. Work together. Be inclusive. Give everybody else a hand and rise each other up. And 2, shed the orthodoxy. We cannot be beholden to what we've been doing for the past 30 or 40 years. Kiss in the ring, orthodoxy, this is always how it's always been. Those days are done. This is a new day. We've got to work together.
Hi.
Hi.
My name is Kelly, and
Hi,
I
Kelly.
just formed a nonprofit that will be giving away free cannabis tinctures, non-psychoactive to cancer patients.
Cannabis?
Yeah, cannabis, THCA, so it's non-psychoactive. to cancer patients and veterans with PTSD. And I love your idea of bringing everybody together, because that's my vision for the nonprofit, to be able to reach out with different veterans groups and cancer support groups. So what is one takeaway that you would give to me to being able to network, to be able to earn a seat like at a place like yours?
Golly. Scott, you want to take that? No. Again, I think, in our community in Colorado, cannabis is celebrated, right? And so we have to think about a little bit of the politics at play and all of that. Build your own personal brand. If no one else is doing it in your community, you take the torch and build that brand, right? I turned on MikeBiselli.com years ago, started blogging about my ideas, started putting up video, started going around and talking about these crazy ideas that I have, right? And don't take no for an answer.
Awesome.
Yeah.
Thank you.
To all you entrepreneurs in this room, please take the time. You want to start talking about how to build and scale a company, you have an amazing resource in this room right now. Get up and ask some questions. This guy is absolutely... Scott truly is one of the prime examples of how we're moving healthcare forward in Denver. So any of you entrepreneurs, don't be shy. Does some of this make sense? I hope a lot of it does. And I hope it makes some of us a little bit uncomfortable, because we got to start thinking different and talking differently about what we've been doing. Hi.
Hey, Mike, I'm just a little unclear. So what advancements have you made as a group working together? If you could just define 3 of them, that'd be great.
So I just read to you about our state's HIE and Delta Dental. So this campus, building this building, is to do exactly what we're doing in here tonight. Meeting people, networking, learning from one another, right? Where did that question take you? So Delta Dental and the HIE is one example. They met in this building, and now they've delivered on that press release I told you today. SiriusMD, which we're both friends with their executive team, a telemedicine platform, they signed their lease about a week before Kaiser did years ago. All of a sudden, those executives got in the same room because they were going to be tenants in the same building, so let's get to know one another. Then
What advancements have been made?
that's what I'm about to tell you, an advancement within Kaiser. So Kaiser didn't really have a telemedicine initiative. SiriusMD was an up-and-coming telemedicine platform. All of a sudden, we got them in the same room because they were going to be community members in this building. All of a sudden, then they started testing the SiriusMD technology. One thing led to another. They started implementing it in region after region. Then they turned on text with the doc. They just saved, a couple months ago when I talked to the CEO at SiriusMD, in 1 week, they prevented 4 suicides. 4 suicides in 1 week because they met here. I don't know what else to tell you in regards to proofs in the pudding, but there it is. Yeah, Nimble Science, the fall prevention technology, partnered up with the SCL Health System, right, to help with our elders and preventing those falls, which is a massive drain on our system. They met in that cafe that you saw at the happy hour, right? Does that make sense?
Looks like we've got time for one more question.
One more.
Scott, you mentioned scaling a distance learning company as your precursor to starting MyStrength. I'm wondering what you think the established healthcare industry could learn from online education.
It's a great question. I mean, basically, we kind of stole a page from our playbook and really formed the foundation of MyStrength. What I mean by that specifically is when I was running the online university, we had 25 online curriculum developers, and we had multi-million-dollar textbook relationships. So we'd take a textbook and we'd convert that into an interactive experience. And so we said, could we do the same thing and apply it to mental health and behavioral health? And so we identified the most dominant publisher in the behavioral health space. It's a privately held California-based company called New Harbinger. And most clinicians have trained on and used these materials in their intervention sessions. And so we went off with probably a napkin or a 3-page PowerPoint and said, hey, here's our vision. We want to take your incredible content, your efficacy, and transform that into interactive tools and resources. And luckily they agreed to that as a 3-person startup and really provided us the clinical foundation to kick off. So quite frankly, we owe a lot to our experiences in distance education because it really served as the kind of basic playbook for us as it relates to our company.
Thank you.
Thank you so much.
you.